Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Welcome. My name is Annie Rogers, and on behalf of the Attitude team, I would like to thank you for joining today's ADHD Experts presentation titled Virtual Mental Health Providers: How to Get Quality ADHD Care Online. Shorter wait times, appointments from nearly anywhere, and a bounty of available specialists. It's really no wonder that patients find virtual healthcare so promising. Telehealth is not new, but since the onset of the pandemic, online treatment has become the norm for many of us. Faced with so many new options, though, how can patients be sure they're receiving effective ADHD care in a virtual atmosphere? Whether you're seeking virtual or in-person services, today's webinar will discuss what a proper ADHD assessment and high-quality ADHD care looks like. We'll learn the best practices in the delivery of telehealth and how to advocate for the best care in the virtual space. Leading today's presentation is Dr. Maggie Sibley. Maggie Sibley, Ph.D., is a psychologist and researcher at the University of Washington School of Medicine. You can learn more about Dr. Sibley and her work at www.margaretsibley.com. That's margaretsibley.com. Before I hand over the microphone to Dr. Sibley, I do have just a few housekeeping items. Those of you who are tuned into the live webinar may submit your questions for the expert at any time. Just navigate to the text box under the video player. To download the slides, click on the Event Resources section of your webinar screen. And if you are interested in the Certificate of Attendance option, look for the instructions in an email you will receive about an hour after the live broadcast. If you are listening in replay or podcast mode, visit attitudemag.com and search for podcast 406 to access the slides, the webinar replay, and the Certificate of Attendance option. If you are interested in learning a bit more about the promise and challenges of ADHD telehealth, you will want to read the feature in our forthcoming fall issue of Attitude Magazine. To make sure you receive the issue, visit attitudemag.com/subscribe and sign up for the magazine today. Finally, the sponsor of today's webinar is Inflow. Inflow is the #1 app to help you manage your ADHD. Developed by leading clinicians, Inflow is a science-based self-help program based on the principles of cognitive behavioral therapy. Click the link on your screen to download now on the App Store and Google Play Store. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without any further ado, I'm so pleased to welcome Dr. Sibley. Thank you so much for joining us today and for leading this really timely and important discussion on telehealth and ADHD.
Thank you. And everyone, it's so good to be here. I'm looking forward to this conversation, not just the presentation part, but also the Q&A at the end. Starting out, I want to just share my disclosures relevant to this training. I think mostly that I've received some consulting fees from Supernus Pharmaceuticals, and also that I have a book on treating ADHD that I get royalties from Guilford Press. So here we go. We are going to try to cover 3 topics today. First, I want to talk a little bit about what is telehealth. How do we define that? Then I want to share with you all what guidelines professionals have to follow when diagnosing and treating ADHD in adults. Then I'm going to go forward and talk with you all a little bit about whether providers can follow these guidelines and deliver high quality care using a telehealth modality. So what is telehealth? Telehealth is defined by the federal government as two-way, which means patient to doctor, real time, which means that we are interacting with each other, communication between the patient and the provider, not at the same site. This can include a lot of things like live phone calls, video calls, receiving and sending messages through a patient portal, using remote monitoring tools from your home to send a doctor information about your health. So in the modern era, we're all using lots of different applications of telehealth and pretty much all of the healthcare that we're receiving. It's important to realize that telehealth is a mode of delivery. It's not a different service. It's the way that we deliver services, and the same professional standards that apply to face-to-face care also apply to telehealth. In terms of ADHD, we can see telehealth entering the diagnostic and treatment world in a few different ways. We see online diagnostic assessments, cognitive behavior therapy that can be delivered online, medication management for stimulant or non-stimulant medications, remote monitoring of response to medication or cognitive behavioral treatment, and then follow-up appointments with the provider to monitor your progress after treatment has been discontinued. Telehealth has some benefits and some disadvantages. So what are some of the benefits? First of all, as you all know, you can get healthcare wherever you're located. So that's probably benefit number one. And because of that, we've got a lot of barriers that are reduced, such as people who live in towns that don't have a provider with specialization in ADHD, people who have to go and take time off of work and find childcare to drive an hour to go see a provider. That's really disruptive. To be able to connect with someone at your home or your workplace, that has huge advantages for people. You don't have to take that time out to wait in a waiting room for an hour. And most recently in the pandemic, this has been also a safety measure. It's helped limit exposure to COVID-19. And as a provider, my favorite benefit of telehealth is that when I'm seeing folks over a video conference, I get to learn a little bit more about their home environment and understand what the day-to-day life of my patients is like. There are also some disadvantages of telehealth. For ADHD world, number one, I think, is that some patients have difficulty resisting the urge to multitask. And so they may not be fully paying attention because there are other things popping up on the computer screen or on the phone. We also have this concept in the telehealth world called telepresence. Telepresence is how much it feels like you're really one-on-one in the same room with the person. And for some people, they feel like there are issues with telepresence when meeting with online providers, right? It just doesn't feel the same as in person. Other people don't mind it. Some insurance companies also don't reimburse providers the same way that they do for in-person care. And so for providers, there can be, on our side, obstacles to providing telehealth if we're not getting the same level of compensation as we would if we were in person. So what are the diagnostic standards for ADHD that people delivering care through telehealth should follow? Well, it's the same diagnostic standards that people delivering care not through telehealth should follow. I'm going to start with the very basic part here, which is the DSM-5. This is the Diagnostic and Statistical Manual of Mental Disorders. It is the rules that providers have to follow when diagnosing ADHD. They need to make sure that the person in front of them meets all of the criteria. And this is what they are. First of all, there's a list of symptoms of ADHD that you have to have enough symptoms present from the list to confirm that your symptoms are elevated compared to the general population. And so for adults, there are two lists. Each list has 9 symptoms on them. One of the lists is inattentive symptoms. The other is hyperactive impulsive symptoms. And adults need 5 symptoms off of one of the 2 lists. If you have those 5 symptoms, and so therefore we feel pretty convinced that you have an above average amount of ADHD symptoms, then you have to meet a few more criteria. First of all, we think about ADHD as a life course disorder. It's generally thought of as something you're born with and something that kind of emerges over time. Not everyone is diagnosed in childhood, but hopefully We have enough information when we're diagnosing an adult that we can learn about their childhood and agree that those symptoms were probably always there, but for some reason that person never came to the attention of mental health professionals. So we have a requirement that we have to sort of substantiate that the symptoms started before age 12. And we have to make sure that the symptoms are not just restricted to a single situation, like a really bad, hard boss, right? The symptoms have to be present in multiple settings. At home, they have to get in the way. At work, they have to get in the way of your social life and other contexts. And we have to make sure that the symptoms are problematic enough that they're actually causing difficulties in your life. So there are certainly people out there with ADHD-like tendencies in their personality, but we only give the medical diagnosis of ADHD if the symptoms are strong enough that they're really causing the person a lot of problems in their life. Finally, we have to make sure that the symptoms of ADHD that have been checked off on the list are not better explained by another reason. So there are a lot of medical disorders. There are a lot of other mental health disorders that share features with ADHD. And clinicians diagnosing ADHD have to be very diligent to make sure the symptoms aren't coming from another source. So, how's ADHD diagnosis different from other mental health disorders? This is an important point I want you guys to remember. Diagnosing ADHD, especially in adults, takes a lot more detective work than it does to diagnose, say, an anxiety disorder or a depression disorder, or other types of disorders in the mental health spectrum. Why is this the case? Well, first of all, ADHD symptoms can be subjective. We'll talk more about all of these different bullet points in a second. They can overlap with other conditions. There's a lot of symptoms on those lists that also are symptoms of other disorders too. ADHD has a lot of mimics. We'll talk about what those are. It also has diverse expressions. So there's no classic case of ADHD. Every version of ADHD is a little bit different than somebody else. And so it can be difficult to kind of be sure that what someone's experiencing is ADHD because there's no textbook ADHD out there. Also, ADHD can be masked by strengths. So there can be symptoms someone's experiencing, but they're really hard to tell they're there sometimes because other things compensate for those symptoms. And a lot of the ADHD symptoms are internally experienced, which means only the person who has them could possibly notice they're there. And they don't always represent a sudden change in functioning where we can notice, oh no, this person's been laying in bed all the time. I think they might have depression. Something's clearly started and gone on. This person's having tons of anxiety. It's clear that there's an anxiety disorder. Sometimes, people with ADHD just slowly experience a difficult, their life getting more and more difficult until they hit a breaking point. And so it can be kind of hard to sort of like pinpoint its onset and pinpoint a lot of things about the timelines of symptoms. And ADHD requires multiple perspectives and comprehensive history taking. So unlike a depression or anxiety disorder diagnosis, where you can pretty much just talk to the person, get them to fill out some key questionnaires that really kind of make it clear what's going on. For ADHD, you have to talk to other people besides just the individual to make sure you have full good information on whether or not they have the disorder. And so our understanding of ADHD is that this is a chronic disorder. It's something you pretty much experience most of your life in most cases. It doesn't necessarily go away, but it can be managed successfully to the extent that it doesn't interfere with your life anymore. Most of our science suggests that ADHD has biological origins. Most cases of ADHD can show a family history, genetic risk. We have identified some biosignatures of ADHD, but we're not precise enough with them that we can use those biosignatures to diagnose. And also, because ADHD is a heterogeneous disorder, it means that there are more than one path biologically to the ADHD diagnosis. There's a collection of different genes and collection of different regions of the brain that contribute to ADHD. And so no two people necessarily have the exact same biosignature of ADHD. But what we do know is that typically we see dysfunction in rewards processing areas of the brain, cognitive control, and executive functions. Those are some of the common neurocognitive features of ADHD. We know that environmental factors typically don't cause ADHD in terms of what our science says, but certainly can contribute to it and exacerbate existing biological risks. So, why is it a challenge to diagnose ADHD in adults? I'm giving you guys the inside scoop from the provider. So, this is the symptom checklist for ADHD. As you're scanning it, this is where we have the two lists. On the left, the inattentive, and on the right, the hyperactive impulsive. And you have to have 5 symptoms off of either of these lists in order to be diagnosed with ADHD. So, one point here is that you could come up with multiple combinations of symptoms that people could have that aren't anything like each other, and they would all get the ADHD diagnosis, right? So ADHD looks different in different people. And you can see that as a very first pass, we have to screen and make sure that, somebody thinks that enough of these symptoms are there. We could get a score for a person on those symptoms by having them fill out a checklist and having them write down and endorse how severe those symptoms are. And we could add that up and give everyone a score for how severe their ADHD is. And what we're looking at now is a slide that shows that ADHD is on a continuum. This is a really important point. So if you look at this graph, the very middle score is a 0. That 0 is a person with average abilities in the ADHD spectrum. So think about it this way. This is the average person, how severe their symptoms would be on that checklist. And you can see that there are people whose ADHD score would be way below average, which means those folks actually have strengths in these areas, right? They're super organized. They have super good memories. They really focus well, right? You've got about half the population who's above average on ADHD. And then you've got about half the population to the right. These are folks who are below average on ADHD or higher on the ADHD scores, right? So they have more problems. What you can see here, if you look at the left axis, that's the percentage of the population that has a score at the level on the bottom part. So you can see that about 40% of people have more ADHD symptoms than average, about 40%. But if you go all the way to the right and you see those high scores of like 2.5 or 3, it's only about 5% of the people that really have very severe ADHD symptoms. And so from a medical provider perspective, we're only comfortable diagnosing a medical disorder in folks that are really at that severe level. That's about 5% of the population. But there's still probably another 30% or so people who have some ADHD-like tendencies, but certainly not in the clinical range where that would warrant a diagnosis and treatment and care. And so this is an interesting dilemma for providers because that line isn't necessarily always very clear. And so we're doing our best to try to figure out, is the ADHD severe enough in a certain case? Also, the symptoms are subjective. So this is the office of Professor X. And if we looked at this office, I don't know what you guys think, but to me, it looks kind of messy. But if I ask for Professor X's administrative assistant, do you think Professor X is disorganized? Rate that on a rating scale. The assistant, of course, is going to say, absolutely, highest score ever. There's papers everywhere. I can't find anything. It's a mess. There's something from 1983 that's sitting on the floor. But if I were to ask Professor X, do you think that you're disorganized? Rate yourself on this checklist. Professor X might say, absolutely not. I have a whiteboard system. I write down really carefully everything I need to do to manage my time. I stay on top of all my deadlines. And I have these really organized piles in my office by year and project so I can quickly find what I need. So as you can see, the symptoms are subjective. And this is why we ask multiple people when we're doing an ADHD diagnosis to get a sense of, the full picture for a person and trying to really understand what's there. Some symptoms are internal. The most Notable ones being daydreaming, focus problems, restlessness, aversion to boredom, distractibility. And it's hard sometimes as a person to sort of self-assess. Do I daydream too much? I don't know. I daydream sometimes. Doesn't everyone daydream sometimes? How do you know when you're telling a provider your experience, like if that's more than it should be or not, right? Because it's on a continuum. So it's really hard. And then the provider's kind of trying to like just get you to describe your experience, and they're trying to make that judgment too. And it can be really tricky. ADHD expresses diversely. So that's my slide sort of saying, oh my goodness, like there are so many different ways that ADHD can come out in folks. And so as providers, we're not looking at sort of a classic textbook case of something as we might for, a physical health disorder. And ADHD has a lot of mimics. Let me show you some of them. Overly demanding lifestyles. That's a mimic for ADHD. Sleep problems. That's a mimic for ADHD. High stress, anxiety, depression, cognitive effects of alcohol or drugs, cognitive effects of aging or hormonal changes, physical conditions, thyroid, cardiac, obesity, medication side effects, unhealthy diet or lack of exercise, effects of trauma. So all of these things can certainly exacerbate ADHD that's already there. Some of these things can be caused by ADHD, but also these things occur outside of ADHD in many people and can look like ADHD. So especially when we're meeting with folks who might be middle-aged or older adults and have never been diagnosed and are experiencing being overwhelmed, cognitive difficulties, trouble focusing, we have to figure out as providers, like which of these folks have masked ADHD that hasn't been diagnosed, and which of these people are just, experiencing 2022 and life is, putting a lot on them. And it's not really ADHD, this chronic disorder since childhood, but just sort of like the experience that the person is having right now in their life. And the answer is that we do care because the treatments and the solutions are different depending on what the causes are. That's important, right? So let's revisit those criteria for ADHD. Have to have 5 symptoms off the list. So people with the mimics, they would have those 5 symptoms. Have to have symptoms present to prior to age 12, may or may not, right? So that would be a good clue for us. If the person has been, wasn't experiencing any traces of ADHD, until recently, that would be like a clue for us that maybe that's not actually ADHD, it could be something else. Several settings that the symptoms are present in, right? So we would be looking like, is it just this stressful job that you've had for the last couple of years? Is that really all it is? Because if it is, that's a different solution than, if this is pervasive, in all areas of your life. Is there clear evidence that the symptoms cause impairment? That's important. And you know what? For a lot of those mimics, it would cause impairment still. And then finally, the E, that's the important criterion, right? So not better explained by something else. So why should you want a correct diagnosis? I mean, I get it. You could look at this 2 ways, right? Like, who cares if the diagnosis is accurate or not, as long as the treatment helps me, right? So that is an important point. But the diagnosis informs treatment because your ADHD symptoms, or whatever the symptoms are not going to get satisfactorily treated if you don't pick the right treatment. So for example, the ADHD treatments that we have are not going to be effective for stress. They're not going to be effective for sleep problems or an unhealthy lifestyle. In fact, it can be harder to overcome sleep difficulties for certain ADHD medications that you might be taking that, contribute to feeling awake. If you have anxiety, depression, or trauma, our ADHD treatments don't help with that. If you are struggling with drugs or alcohol, our ADHD treatments don't help with that. And for a lot of folks, aging does impact cognition, does reduce processing speed. We see hormonal changes in women as they get older that can look a lot like the cognitive symptoms of ADHD. And so we're trying to tease apart those differences as high quality clinicians that are trying to give you the right answers, right? Also, physical conditions would need to be treated for the physical condition and not the cognitive symptoms. Okay, so best practices in ADHD diagnosis. This is the care that you should be receiving. Let me say this. If you've been diagnosed with ADHD for years by a provider who did a good assessment, you don't necessarily need to re-go through this best practice in a first-time ADHD diagnosis every time you switch providers. That diagnosis, if it's one we're confident in, can follow you, and you don't necessarily need to receive this high-intensity care. But if this is the first time you're coming to clinical attention for a possible question of ADHD, then this is really important for us to take this care with you. Who can diagnose ADHD? This is really important. First of all, it needs to be a licensed clinician. And that licensed clinician needs to personally interview the patient and review all additional information collected. So that person needs to be who you're working with. The professional should be well-trained in ADHD assessment. And that means that not everyone that's licensed has competency in this area, right? It's not something that's taught in the core training of medical school. It's not always taught in the core training for mental health providers, but people who want to specialize in this area will get special training on it, and they'll know how to do this well. Commonly, this will be a primary care physician or a nurse practitioner if you're kind of working in the primary care setting, and those folks are completely competent to do this. Also, you may get referred to a specialist like a psychologist or psychiatrist, and those folks obviously specialize in ADHD care, but they may not always be accessible in all communities. Best practices and kind of gold standard way to diagnose ADHD starts with a patient interview in adults. This would be usually about 90 minutes or longer, based on the practices of most people that I'm aware of and recommendations. So this would be getting a health and mental health history from folks, a timeline of the onset of symptoms, context where symptoms emerge, examples of impairment. You might be asked to provide concrete evidence and should assess for those mimics, right? So this 90-minute conversation is really important and can be a really key piece of us figuring out, like, is ADHD really present? Part of this also includes obtaining multiple perspectives, which is best practices. So think about it this way. We have to get information from other people who know you well in order to be confident that the symptoms are there. Parents, siblings, spouse, close friends, coworkers. If you think about it, it's not to say that we don't trust the person self-reporting, but we want the big picture. And just like we saw with Professor X, it helps to just cast a wide net on this information, sort through all of it, and try to figure out what's going on. We love to get someone who can describe you in childhood, because I don't know about you guys, but it's really hard for me to try to describe how I was at age 6 or 7 to someone. You need to get someone who can kind of give a sense of what you were like, so that hopefully we can gather some information about that chronic piece, whether it was there, all the way since you were a child. And this helps with the subjectivity of symptoms. Also, this may include a physical exam or cognitive or educational testing. So this isn't standard, but if we're wondering about a possible alternative to explain the symptoms, then we might ask for a physical exam, or we might have some cognitive or educational testing. So this is something that, as you'll see, maybe this is the piece that can't really be done over telehealth, but still we can refer you to someone who can do this in person. A lot of people ask, is there a computer task to see if someone has ADHD? So categorically, the answer to this is no. There's no research to suggest that there's a computer task that can tell you if you have ADHD or not. These tasks can be inaccurate. And, even if they can be accurate 80% of the time, that's still 20% of the people that we're getting wrong. And with something as important as a medical diagnosis, knowing that we can accurately diagnose it without these tests, it's not recommended that people use computer tests to diagnose ADHD. First of all, they only tell you about how well you're focusing or how well your memory is working in the 30 minutes that you are taking the test. Second of all, it doesn't necessarily generalize to how well you're focusing on the 30 minutes outside of that test, right? And it can be influenced by things like mood, your motivation or interest level, the amount of sleep that you're getting, distractions, stress, hunger, things going on in your environment that can influence your score on that test during that 30 minutes. And there are people who score very poorly on these tests and they don't have ADHD. There are also people who have ADHD that score really well on these tests. And so these are not usually recommended. Some people like to give them as an extra piece of information when they're making a diagnosis. But I would say that in general, we don't want to see anyone making a diagnosis just based on these tests. The providers should also be giving feedback to you. So you should be invited for a second appointment where the provider sits down with you, explains, the conclusions that they came to in their testing. And then following that, they would sit down with you and make some recommendations for you. Often this includes a written diagnostic summary. So can you do this over telehealth? Yeah. So the patient interview and feedback can occur over a video platform. That's no problem. We can collect the rating scales from other informants through a patient portal or secure survey link. There's some aspects, the physical exam, the cognitive educational testing that may need to occur in person, but these aren't always necessary for an accurate diagnosis. So they're kind of secondary anyways. So what treatment standards should telehealth follow? There's 2 evidence-based treatments for ADHD based on research. One is the category of pharmacological treatments, and the other is cognitive behavior therapy. Everything else would be considered experimental at this point and not well established yet. Pharmacological treatments include stimulant medications and non-stimulant medications. There's actually 2 now that have been FDA approved for adults as of like the last couple of weeks. So atomoxetine and then viloxazine. But stimulant medications are first line treatment, which includes methylphenidate or amphetamine derivatives. Cognitive behavioral therapy is the other evidence-based treatment for ADHD in adults. And this is learning strategies to manage your ADHD symptoms without medication. It also addresses thinking patterns that exacerbate your ADHD related to self-doubt or procrastination or motivation difficulties. As far as pharmacological treatment goes, so what does evidence-based medication management include? This is what your providers are supposed to be doing. Medication selected based on professional guidelines that's tailored to the patient profile, right? So the recommendations are to start with a stimulant, but there are different ones you can try. They all have sort of different profiles to them in terms of how long they last, different side effect profiles, different ways they're released. And so we can figure out the one that best fits your life and your biology. And so that's usually the first thing that would be tried. Face-to-face visits should be happening. That can include video with the prescribing clinician every 30 days until you've gotten that dose figured out and that medication figured out with them. So depending on how quick of a responder you are to the first thing that's tried, these visits could be every 30-day visits could be fewer or more. And then when you're having those visits, there should be careful review of medication effects on symptoms as well as side effects. Discussion of when you're taking the medication, how frequently you're remembering to take it. They'll monitor your vital signs like blood pressure, heart rate at each visit, and they'll adjust the therapy as needed. Once you're kind of stable on a dose that's working for you, then usually you would be meeting less frequently. So that would be every 3 months commonly. Can we do this over telehealth? So yeah, face-to-face video calls with the prescribing provider can occur as with in-person care. Vital signs can be monitored with at-home monitoring devices. So this is all feasible. There are some legal issues though. So in the US, stimulant medications in particular are classified as controlled substances by the DEA. There was a temporary lift of this during COVID-19. So, we could prescribe stimulant medications over video interactions during that time. But, that's a temporary lift. And so that may not be a permanent lift. And we still are waiting to find out about that. Then with cognitive behavioral therapy. So CBT, what does it usually include? So organization skills and time management strategies, learning about how the relationship between your thoughts, feelings, and behaviors can exacerbate your ADHD, setting personalized treatment goals, monitoring progress weekly, helping you figure out what environments and what lifestyle factors help you succeed and feel your best, problem-solving challenges in your life, emotional support for, ADHD-related difficulties, thinking about how the people in your life can support you. So a CBT therapist works with you on all these different things. And you can imagine how that's a great complement to medication, right? Like not only are you biologically learning to focus better, but now you're kind of also thinking, well, how do I arrange my life to be successful, given that I'm going to have maybe to deal with these symptoms in the long haul? CBT should be delivered by a licensed person, a mental health therapist. So that's usually a psychologist, a social worker, a licensed mental health counselor. So, and even though a lot of the things on this list don't seem like rocket science, it's more about just that the complications that can stem from ADHD while you're sort of like trying out all these new ways to your life need to be under the care of somebody who is licensed to take care of things if things take a left turn, right? You need to have the person there who knows what ADHD looks like when it's getting worse, who can help make sure that you're, if a crisis happens, that you have the support that you need. And so it is really important to get this kind of help from somebody who's trained and licensed. CBT can be group or individual, and you can run groups online as well. And patient is given therapy homework each week to try to apply the things they're learning to their lives. CBT is typically short-term, so like 3 to 6 months, which means that it's not like long-term supportive therapy with a psychologist for years and years. It's really designed to kind of give you tools and let you kind of spread your wings and fly away with those tools, and take your life in a positive direction. So can CBT be delivered via telehealth? So yes, a lot of people are doing CBT via video calls now, and you can share your screen to do worksheets together. You can email people resources, send things through the patient portal. You can even do groups if you use a HIPAA compliant platform. And of course, though, our one disadvantage to CBT over telehealth is that temptation that patients can have to multitask. So we do have to kind of manage that. And sometimes people feel like the telepresence isn't as good as it is in person. So just to sort of kind of wrap up here a little bit, a few kind of closing thoughts. Telehealth service delivery model. So I want to point out the difference between your local providers and your telehealth startups. So the local providers are people who've been providing in-person care for ADHD for years. And when COVID-19 pandemic happened, maybe they pivoted to telehealth because that was what they needed to do. So now they're providing the same services they would have in person, but over a telehealth platform. They're billing using traditional methods. Some people like doing telehealth and are going to keep doing telehealth even though COVID's over, which will give us more options for care, which is great. Now, telehealth startups are newer, and we don't know all of the details of the models of these companies because, they are just emerging. And as someone who doesn't work for one of those companies, I can't really speak to exactly what their models are. Some of you guys might have been patients of them and may have some stories, but generally the difference here is that these models are profit-driven venture capital models, right? So they're startup companies. They're trying to make a lot of money. they could have really good benefits to them potentially in terms of, expanding the national reach of care. So that could be a really good thing about them. Details of these business models are still emerging, and they probably have a different billing model. So they might charge a subscription for care. And so just some considerations about the landscape of, digital treatment for ADHD. So one thing that's also going on the side here is that social media platforms like TikTok are doing something for ADHD. They're increasing awareness of ADHD. They're decreasing stigma around ADHD. People are seeing people that look and talk like them on TikTok explaining what ADHD is like, and it may be causing people to question, maybe I have ADHD. This could be really good if we find people who are struggling and need treatment, but have never been diagnosed. So that could be a really good thing. But the other side of this coin is that there was a recent study done in Canada showing that only 21% of the TikTok videos on the topic of ADHD were classified as useful. A majority were classified as misleading. And so this is one of the tricks when we can give a megaphone to anyone, any stakeholder in the ADHD community. Not everyone has good information, and maybe people can get confused when they hear bad information, when they hear a characterization of ADHD that isn't actually accurate. This is fine. I think that questioning going on is healthy and okay, as long as people who are wondering go to a provider who's providing responsible care. That clinician does a good, careful job of sorting through all the clues, doing the detective work, and giving a good diagnosis. You can find out for yourself, do I have ADHD? So if you're curious, definitely go to a provider, tell them why you think you might have it, and see what they can learn. But if you go this route, here's what you need to be looking for. The provider you should see should always be licensed. This should be the person that meets with you face to face. They should be making diagnoses, a first-time diagnosis. If you've never been diagnosed before, they should be making a diagnosis using procedures that follow the professional guidelines, the best practice works that I shared. So this should feel to you like they're doing careful detective work. It's not because they don't believe you. It's because responsibly, there are a lot of things we've got to rule out, and we just have to do our due diligence and make sure we've done that. You deserve that. You deserve someone to listen to you, to hear your life story for more than just a few minutes, and to really get to know you, to make sure you get the care that you need. Including when there's medication management that happens. Remember, stimulant medications are the first line treatments for ADHD. There's only rare cases where you wouldn't start with a stimulant. For example, if you have a history of addiction. Or if maybe you've been on stimulants for years and they haven't worked. So if someone's starting you on something that's not a stimulant, I would ask questions about why they're starting you on that medication. Is it something about you that they thought a stimulant wouldn't be a fit? Or is it just that the stimulants aren't a fit for the business model of the provider that you're seeing? So you have the right to ask those questions. Also, you should have somebody who explains to you all your treatment options, right? You could take a stimulant, you could take a non-stimulant, you could do CBT, you could do a combination of CBT and one of the medications. They should explain to you the pros and cons of those different options and let you get involved in the decision-making. That's best practices in care. It should be a two-way conversation so the patient has some sort of say in their care. Like I mentioned, you should be meeting with them for, at least 90 minutes, I would say, unless you're someone who's got a long-standing ADHD diagnosis. And you want a person who's going to be monitoring your medication carefully and regularly and making treatment recommendation based on what's best for you as a patient after getting to know you well, and not based on the best fit for their business model. So I'll stop there and we're going to do some Q&A. I'd be really interested to hear about people's experiences with different types of telehealth. And I will stop there and ready to answer questions.
Great. Thank you so much, Dr. Sibley. That was a really comprehensive overview with a lot of things to consider. And I will get right into Q&A after quickly thank Inflow once again for sponsoring this webinar. I wanted to circle back on a comment that you just made about stimulants versus non-stimulants. And someone was wondering if high blood pressure could also be a reason for being prescribed a non-stimulant as opposed to a stimulant?
Just a caveat, I'm not an MD, so this isn't my day-to-day, but they do monitor blood pressure when they prescribe stimulants, and that could be a reason that they decide that the medication wasn't a good fit for you. Whether or not they would take an existing, blood pressure concern and have that influence the initial prescription, I would defer that question to an MD who could talk about that thought process for them.
Gotcha. And probably just to underscore the point, though, that it is beneficial to have regular monitoring if you do have high blood pressure, which may be more challenging in a virtual environment. And let's see, you talked here at the end about some of the signposts of quality ADHD care. And one of those I wanted to underscore, and that was meeting sort of regularly to check up on how the patient is responding to the medication. Can you talk a little bit more just about that process, what a patient should expect when starting out on a new medication, the process for adjusting the dosage and managing side effects?
So the providers should be meeting with you within 30 days of your prescription to review how that prescription is impacting you. And so sometimes they will systematically give you like a questionnaire to fill out about your symptoms and the side effects that you're having, and then they'll review that with you. Or other times they might do it in more of a conversational manner. But either way, those are the key things they should be asking you about, making sure that the taking of it itself is fitting into your life, that you're taking it regularly, you're taking it at the right time. And if they detect that side effects are not satisfactory, or they detect that it's not working optimally for you, they might make a change either to the dose they're giving you or to the actual formulation itself that they might be giving you. So they are titrating is the word we use, right? They go in and they're trying to like really gather information about how the medication is impacting you so they can make a judgment based on their professional experience about if that's the best fit for you or they can do better.
Okay, that's helpful for setting expectations. You should not receive a new prescription and then with no plan for following up. It is almost always a process to get the medication just right. And a few questions came in also about what's the best medication for an older adult or a woman or a child. Basically, there is no best medication for any type of person. It's very personal and individual. So I don't want to speak for you, but from our experience at Attitude, that is definitely what we've heard. So any provider who tries to tell you that this is the best medication for someone like you, I would think that would be a red flag, right?
I don't know. It depends on a person's situation. Obviously, like the best example is if you have a history of struggling with addiction, it might make sense not to give you a stimulant medication because that could be a temptation for you to misuse. So there can be situations like that. And I'm sure we could come up with others where there was a clear best medication to start with based on your patient profile. But categorically, there's so many factors that go into what you respond to that it's not as simple as, you have X, Y, and Z features. And so this is obviously going to be the medication for you.
Right. Okay. And I'm wondering about if we have a question here about which assessments or questionnaires are sort of the most esteemed or trusted for testing ADHD symptoms. If there's a specific assessment you should request or look for in your telehealth evaluation.
There's a lot of very similar questionnaires and checklists to each other. The Conners is obviously kind of one of the most well-known. There's a few different interviews that are structured for a provider who maybe likes that better, right? They can get an interview and that can actually tell them what questions to ask you versus somebody who's really experienced, kind of has their own set of questions. And both of those are okay. The main thing is that they eventually get all the right information from you. So the types of things I was mentioning in the slides are the things they should be asking about. If they don't send a questionnaire out to somebody that maybe that's something I would want them to do. Again, not because we don't trust you, but because it's really good to just see the big picture, right? And to get somebody else's take on you too. Because there might be things that they notice in you that you don't even notice in yourself that could help clarify that diagnosis. So, it's mostly it's not which questionnaire they give, but that they're giving them is that most important thing.
Gotcha. Okay. Lots of questions coming in about CBT, as well as coaching for ADHD. And just wondering about good, esteemed ways of finding qualified CBT practitioners, as well as ADHD coaches. I'm wondering if you have any guidance on either of those.
It's easy for me to speak to the CBT part first. First of all, if you go onto a website in the US like Psychology Today, and you can see all of the providers in your area, and you're looking for people who say they specialize in ADHD and say that they have an orientation of CBT, that's what I think is the easiest way to find someone in the US. And you can ask them questions about are you comfortable working on me with X, Y, and Z, issues? And that's a good way. And there's a lot of people who are well trained in that. Coaching is a tricky one because I think there are great coaches out there and it can be helpful and effective, but also I'm not sure how to tell the difference between a good coach and somebody who they woke up one day and decided they wanted to be a coach, because there isn't a lot of regulation of coaching yet. And we also haven't done any research, good high quality research on coaching. I think a lot of coaches are doing different things from each other. So at this point, probably word of mouth in your community is the best way to find a coach that you can trust, somebody who's worked with that person before and can vouch for them. I hope we get to a place where we have better regulation of coaching so that we can hold people accountable for if they say they're doing coaching, that they're doing good things. But there's a lot of people who are saying they're having really positive experiences with coaching. The main thing I would say is just, if you get in CBT from a mental health practitioner, you can get that reimbursed by insurance, right? And so it's often more cost effective for people to do that. And if you're getting coaching, a lot of times that costs more money. So there can be prohibitions for certain folks with more limited resources. So that's a thing to think about as well.
Okay. And we will follow up the Attitude team. We do have some resources on ADHD coaching in particular, just some organizations that add some credibility. And we'll share that information in the resources from this webinar to follow up on that line of questions. We are hearing here at Attitude quite a few people who have received ADHD evaluations and care for the first time over the last 2.5 years. And as you mentioned, the prescription of stimulant medication has only been possible virtually, really within the last 2 years due to the loosening of restrictions due to COVID-19. It's quite likely, as you mentioned, that those restrictions are going to go back in place. And people are wondering, what can they do now? So say they're using Cerebral and they've received a prescription and they're happy with the results. And soon Cerebral will no longer be prescribing medication. Can you recommend any next steps for these people so that they don't have their treatment disrupted?
I think it would be a good idea to identify a transition plan for your care in advance to figure out who can take you on. This isn't specific to Cerebral. If you have a provider who is retiring, if you have a provider who is, moving out of the area, you're always looking for a transition plan for care. And usually the provider who you were seeing is the one who should take on the burden of helping you find somebody new. So I would say one of your first things you should do is talk to the provider that is going to be discontinuing care and ask them if they can give you a recommendation, because they know you best. They kind of know what kind of person you would work best with. And that's often how it's done. If for some reason the person you're working with now is not able to give you a recommendation for someone to take over that care, then, I think always a touch point is your primary care provider. They may not be the one to take it over, but having them help you find a provider in your community, or someone who can see you that is a good fit for what your needs are, is always helpful, to go back to that touch point and talk to your primary care provider.
Right. And yes, we do not know exactly what the timeline will be, specifically around the prescription of stimulant medications, but we do know Cerebral will be discontinuing that service in October, and waiting lists can be quite long. So it would make sense to begin that process now, with the anticipation that the end is near. Okay, let's see. A lot of people wondering, if they're looking at exactly this, finding, in-person prescribing physicians who are offering telehealth care because they live, in an area without any specialists. Do you know of any good ways to find those ADHD specialists who offer telehealth care specifically?
Well, most people are probably trying to get care through their insurance if they're not doing one of the startup models. And so the first thing that you can do is to go through your insurance website and look at who's in network. And you can start by reaching out to those offices and asking if they're willing to do telehealth as part of their care package. And if you are doing this early, hopefully you can identify someone, get on their wait list now, and by the time you need them, they'll be ready to see you. So that's like kind of the number one thing. If you're looking for a psychologist or somebody to do CBT with you, again, if you go onto a website like Psychology Today, or if you go through your insurance and look who's in network and look up their website, usually they say on there if they're willing to do telehealth or not. And if it's not clear, you can always reach out to them and ask them.
Okay. Wonderful. Yes. And I also did want to touch on the number of adults here who do not have a diagnosis, and they're wondering, you had mentioned that symptoms should be present before age 12, but is it true symptoms are often missed or misdiagnosed? So if you weren't diagnosed as a child, that doesn't mean that you don't necessarily have ADHD, that an evaluation at any age could be quite productive. Yes?
That's right. Yeah. So just because no one noticed you had the symptoms before age 12 doesn't mean they weren't there. But hopefully in retrospect, talking with the person interviewing you and sort of going back through records or whatever, you can find some clues to suggest that it was there. If it wasn't there, you really might not have ADHD and you might have something else. And we should get to the bottom of that. Because the main reasons why ADHD isn't caught early on is because maybe you come from a culture where, it's those types of behaviors aren't seen as pathological or problematic. Maybe you have intellectual gifts that allowed you to, do fine in school, even though you might have been, having a little trouble focusing for a long time. But if you look back, you could sort of see there were little traces of symptoms anyways. And then, there's certain people that you could see it in yourself, but people didn't think you had ADHD This happens in women a lot. It happens in people of color, where it's just like, you don't look like what people think of when they think of ADHD. And so like, despite it, being very clear that you had those symptoms in retrospect, like no one ever diagnosed you. So in those cases, I think we're really comfortable making diagnoses, but it's when somebody seemed to be functioning perfectly fine for a long, long time. And then suddenly, they're having trouble, that we're often like just doing the detective work of, could something else explain this? Because that's not what ADHD usually looks like.
Right. Right. And you did mention that some people are particularly good at developing coping mechanisms. And that is often the case in our experience with women, and that they hit these inflection points, whether it's parenthood or menopause, that can kind of push their symptoms into the territory where they're not manageable. So there are those triggers to keep in mind. And I'll just quickly mention the trauma of a pandemic may be something that could cause symptoms to flare as well. Okay, so unfortunately, we are just right at the 1 hour mark. So we have run out of time. Lots of good questions here today, and so much really productive and helpful information. Thank you so much, Dr. Sibley, for leading us through this presentation and contributing your voice to our ADHD community. We hope you can join us again. Make sure you sign up for alerts about upcoming webinars by visiting attitudemag.com/newsletters. If you are listening in replay or podcast mode, visit attitudemag.com and search for podcast 406 to access the slides, the webinar replay, and the certificate of attendance option. If you are interested in learning a bit more about the promise and challenges of ADHD telehealth, you will want to read the feature in our forthcoming fall issue of Attitude Magazine. To make sure you receive the issue, visit attitudemag.com/subscribe and sign up for the magazine today. Thank you again, Dr. Sibley, and thank you for everyone who joined us today for this conversation.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.